This is my final video project for the Master Esthetician class. In this video, I will be demonstrating which ingredients I chose and how I mix them. I will also demonstrate how I apply these concoctions directly to the dog. Now I'm mixing the kale and clay mask. This is cosmetic grade, and I'm using just about a half a cup. I brewed up some green tea, and I wasn't sure exactly how much I needed, so I brewed an entire cup and just kind of added it as I went along. I do really like a watery consistency when I use kale and clay because I find that it's easier to smooth along the body. Next, I'm going to try to add about 2 tablespoons of olive oil. The kale and clay will soften crusty skin. Olive oil also helps soften crusty skin. That's it for the mask. I'm going to make a pre-bath conditioning mask. I'm going to start off with a half a cup of conditioner. I'm going to add a lot of oil to this conditioning mask. The purpose for all the oil is oil breaks down oil, and I want to break down the oil that's on the pet skin and replace it with healthy oils. I'm going to add olive oil and avocado oil, about a tablespoon each, into the mixture. And both of these oils have fatty acids in them, and that'll help with the inflammation on the skin. And then they also have antioxidants. Anything that I can do to help protect the skin from free radicals will benefit diabetic skin, especially because they're immune compromised. Lastly, I'm going to make the cream rinse conditioner. I started off with the leftover green tea that I brewed earlier. Then I added half a capful of fulvic and humic minerals because that's also going to boost the skin's immunity, and just a little bit of conditioner. And I'm going to shake it up and also add a little bit more of olive oil, but I'm going to use a little eyedropper because it's a heavy oil and I'm putting it on a curly coat, and I really don't want to weigh down that coat and make it look greasy. I am pre-soaking my dog to make it easier for the clay to be spread around her body. And I chose to do a full body clay mask, everything but around the eyes, because I kind of want to cover all my bases for the very first treatment. And after the first treatment, I'll just do spot-on treatments every week after while I'm doing my therapies, just on the crusty parts of the skin. So I'm putting a plastic bag over her and some towels. First, a plastic bag to keep the moisture in. I do want to keep that clay wet for a little while. I don't want it to just dry out on her skin. I want everything to kind of just soak into her skin. And the warmth is actually going to help open up her pores and her cuticles, and it'll soak in a little bit more of the oils and the green tea that I put in there. Here goes the first conditioning mask. I can feel that there's a lot of oils in this conditioning mask. I really can tell that it's going to do a good job breaking down the oils that are on the dog's skin and replacing it with these good oils. When I shampoo her afterwards, I'm gonna shampoo most of this oil off, and what's left over is really gonna be the oils that I added to that mask instead of the stinky seborrheic oils that were on her skin previously. And here is the chlorhexidine and climazole. I don't know if I'm saying that correctly, but that's the antifungal, and the chlorhexidine is the antibacterial properties in the shampoo that I used. And The bottle does tell me to wait 5 to 10 minutes. Most medicated shampoos do recommend 5 to 10 minutes on the skin for the the ingredients in there to do their jobs. So I went ahead and I covered her with plastic again and towels, just mainly to keep her warm while she was sitting there and waiting. Okay, our last step is the green tea conditioner that I made. It was very luxurious. It was a very frothy conditioner. It was a cream rinse, but I did shake it up pretty well. And adding that green tea on a whim really made this conditioner feel super luxurious. It smelled wonderful. It still added to her therapy and adding antioxidants from the green tea. And it was just a very natural smelling cream rinse, and I was very happy with it. I would ask this client to bring this dog back to me once every week, and we can do our therapy baths. And I would assess the skin every week to see if there's something that I need to change, add, or subtract to it. Maybe add a little bit less oil next time as the skin heals and I don't have to worry about the inflammation. Maybe I'll add lighter oils instead of the heavy olive oil. Her coat did have a good bounce to it. She didn't look oily or weighed down, so I knew that I did have the right ratio of oil to conditioner. After a week or two, I'd probably be cutting down on some heavy oils and replacing it with lighter oils, maybe baobab. Then I would use spot-on clay treatments instead of full body clay masks. And when the skin seems to look like it's healing, I would change to a general purpose shampoo instead of an antifungal or antibacterial. But I would continue with the minerals. Diabetic dogs are prone to infection, so keeping up with the minerals for every bath will help the immunity of their skin. And that's my conclusion.